Hi, good afternoon, everybody. Thank you for joining our call today. My name is Michelle, and I am the project lead for patients transitioning to a home therapy. And we're going to go ahead and get started. Please make sure to mute your line. And welcome to the Community Coalition Kickoff call for home modalities. Just a couple reminders, please make sure your lines are muted to avoid any background noise. You'll have the opportunity to ask questions after the presentation, or you can also put those in the chat if you have questions as we're going through the slides. We ask that you be present and engaged, and all of this meeting material, the presentation, IPRO Learn under Coalition work section after this call. So just to go over all of the areas that IPRO covers, we have Network 1, which is the New England area. We have Network 2, which is New York. And then Network 9 is Ohio, Indiana, and Kentucky. And Network 6, North Carolina, South Carolina, and Georgia. And just to give you an idea of what IPRO's ESRD program covers is 125,477 dialysis patients, which is 1,925 dialysis facilities, and then 54 transplant centers. These are some of the programs that IPRO works under. So QIAs, first being transplant. One of the things we work on is wait list and increasing the number of transplants, home dialysis, patients starting directly on home, as well as patients transitioning to home, hospitalizations, inpatient hospitalizations, as well as ER visits. And then under vaccinations, flu vaccine and pneumonia vaccine as well. Patient and family engagement, we'll talk about that a little bit later. QAPI, life planning, and patient facility representative. And then under data quality, the 2746 forms and 2748. So these are all areas that IPRO works on quality improvement. So just to talk a little bit about health equity, we have an on-site team that are visiting some of the facilities, and some of the things they're working on, as well as our quality improvement areas, is health equity. So increasing awareness and understanding of social determinants of health for your patients, and also looking at different resources and things in the area that they may be able to bring you, and looking at rural health as well as culturally and linguistically appropriate services. So the home goals for this year, this is what CMS has set for us to carry out. We had a new baseline for home because of the goals changing. The incident goal, patients starting directly on home, you now have that 90-day window again to count as incident patient going on a home modality. And so this option period, the goal is to achieve a 15% increase of what we had last year for each network. And then as far as prevalent or transitions, that is now defined as patients beyond the 90 days following their first dialysis start date. And the goal this year is to increase that number by 8%. Due to the Hurricane Helene and the Baxter shortages and a lot of the issues that we're facing right now with patients going directly on home, we decided to split the coalition into two sections. If you're able to start patients on home or transition patients on home, you can choose to work on supporting patient choice of a home modality. If that is you know, if you're having issues where you can't put patients on home or you can't transition patients to home, and you have a home program that you want to work on, you can choose retaining patients on a home modality. So we'll be looking at retention and kind of how to overcome some of those barriers. So what does the community coalition consist of? So first we want to identify a root cause analysis. And throughout that, we'll walk you through exactly through the process of developing a root cause analysis. And a lot of you have probably already went into IPRO Learn to look at um, how to develop this and what your root cause analysis is. But basically, we want to look at like what specific barriers are you having, how to drive improvement in outcomes that CMS is kind of outlaying for us, and allow the network to understand locally and regionally like what barriers you might be having, and then just using this tested process to create improvement within your facility. So this is kind of the steps involved in going through the 5 whys to create your RCA. You want to identify your high-level problem, ask yourself the 5 whys, so kind of go through the stage of like, why is this happening? And find that root cause. And that's going to be what you're going to work on throughout the rest of this coalition. So this is kind of an example we wanted to go through of kind of how to develop that RCA. So the scenario is the patients are not starting directly on home because there was no CKD education prior to starting. So why did that happen? The patient crashed into dialysis and didn't receive education prior to starting outpatient dialysis. Why did that happen? Maybe it was a poor relationship with the hospital. Maybe it was poor nephrology engagement. Maybe the nephrologist or hospital are unaware of CKD education facilities of where they can get that for the patient. And then the last why is lack of communication. So that's kind of working yourself through that, developing what your root cause analysis is. So what is a plan, do, study, act cycle? So once you have your root cause analysis, then you're going to go through the 4-stage problem solving model, which is the plan, do, study, act cycle. And that's where it utilizes like the dialysis facility, as well as like transplant centers or patients or anyone else that you might be working with, to determine what change is needed and getting feedback on that. So this is just an example of what the Plan, Do, Study, Act looks like and kind of what questions go along with each stage of that. And I'll kind of walk you through an example. So as far as the plan, what needs to improve? So if you go back to the scenario that I gave you the last time for the RCA, what do we need to improve? Maybe developing a process for CKD education, involving your IDT team to come up with a plan. How can we work with the nephrologist? How can we work with the hospital? And then educating the hospital and the nephrologist on what your process is for CKD education. And then what will the success look like? So maybe you have an increased number of patients that receive CKD education. And then how will you collect that data? Tracking the number of patients that get education prior to starting on dialysis is a way that you can test that. And then the next cycle is the do phase. So in this phase, you want to start engaging all the key people that will be part of the CKD education process, and who is the CKD educator. And then you want to implement this plan. So you start the CKD education program, you notify the physicians, you notify the hospitals about the process, and you start getting referrals. And then collect the data. You also, like I said, want to start tracking how many patients that are currently in the facility had CKD education and how many didn't. And then that brings us to the study phase. So we want to start analyzing this data. How many patients had CKD education prior to starting and how many didn't and kind of crashed into dialysis? What was the impact of this intervention? Do you have more patients that are getting educated prior to starting? Are more patients choosing home prior to starting? And then what are the lessons? Maybe it's that CKD education is important to decrease the number of patients crashing into dialysis. And then the final phase is the act phase. So how can the change be implemented that we just made? We can identify educators in the facility, work with nephrologists for referrals, work with the hospitals for referrals and to get that information out there. And what are the changes for the next cycle? So we want to continue this process if it's working for us. So this scenario was just an example that we came up with to kind of show you what you'll be doing throughout this community coalition when you go through this PDSA cycle. To help stay on track, if you log into IPRO Learn under the Community Coalition tab, there is an outline in there and it'll tell you like month one, we're kind of going through developing your RCA, having the kickoff call, and it'll give you like a step-by-step of what's going to happen every month from here out the next 4 months. We also have members on our team that do on-site visits. So some community coalition facilities will get an on-site visit by a member of our team. This will include reviewing your data outcomes and areas for improvement. And they won't only be looking at home, they'll also be looking at all of the categories that I went over with you earlier that we talked about we work on quality improvement with. They'll also give any quality improvement assistance if you have certain questions about anything while they're there. Resource and intervention planning to mitigate barriers. And then just ongoing support throughout the coalition. They can help with some of those things. The site visit is not an audit. It's just a visit that they're going through to look at your goals, look at where you're at, talk about your barriers, and maybe help give resources if needed. So these are the 3 members of our team that right now complete the on-site visits. So if you are in Network 6, Joseph Kiswe is our Assistant Director and on-site Technical Assistance Lead for that network. And then Michelle Anderson is the on-site Technical Assistance Lead for Network 1 and 2. And Marie Hurd is our Assistant Director on-site Technical Assistance Lead for Network 9. So some facility expectations throughout this community coalition. We want you to complete that root cause analysis because that's important in developing what your barrier is and what you want to work on throughout the coalition. The PDSA cycle check-ins, we will post in IPRO Learn every month where we're at in the PDSA cycle and ask for feedback of what you're working on, what your plan is, how you're implementing this in your facility, things like that. You can always collaborate with us or schedule a one-on-one meeting if needed. In our email signature, we have a link in there where you can just go put a meeting on our calendar if needed, or you can reach out if you would like to schedule something. And as I said, every month there is a IPRO Learn activity that will be checking in with you along this process. And then share your process with us. Like, what are you working on? What's going well? Any best practices that are coming out of this? Because we generally hold our best practice webinar towards the end of a coalition, just to highlight facilities that have had a lot of success, that tried something that really worked in their facility, to share that information with everybody. And then just dedicate the next like 4 to 6 months of just trying to improve quality improvement processes within your facility and integrate your patients into your work. And Yvonne will be going over the next section, talking about how to integrate patients into your work.
Hi, my name is Yvonne. I'm one of the quality improvement leads for patients starting onto a home modality or starting onto a home within their first 90 days of treatment. So we're going to talk about patient and family engagement. So what is the PFR or the Patient Facility Representative Alliance. This alliance is a patient advocacy group that provides patients, transplant recipients, and care partners the opportunity to share thoughts and experiences on their ESRD care. They help develop strategies on how to get ESRD patients activated in their care. They promote positive relationships between patients, providers, staff, ESRD stakeholders, and the network. You can go to the next slide, please. So the role of a PFR, PFRs, they can do multiple things. Some of the things they can do is they can work in collaboration with their team to help determine their personal plan of care. They can engage in patient advocacy within their facility. They can use their knowledge to educate their peers by reviewing and providing feedback on resources. They can distribute resources to ESRD peers and social workers that, of course, been approved by the facility. PFR members, they attend network-hosted webinars and facility-mediated meetings. They can do lobby days, informational sessions, and they receive direct communication from the network about newly created educational materials. A lot of times we'll actually include them in that development. We'll have a new resource and we'll take it to the group to get their feedback as patients. They also engage with the network and other PFRs through social media and the Alliance group. So CMS goals, here, okay. Facility expectations. So the facility, what we would like is to sign up a patient facility representative to work with the network. If you don't have one, if you could nominate a new one to engage and just help with the quality improvement process. Encourage your PFR to attend the monthly PFR Alliance call hosted by the network. Keep your PFR engaged in your Plan, Do, Study, Act cycle. Get your PFR and other patients involved in QAPI meetings. Inquire if your PFR is interested in being a peer mentor. So we do have one for the CMS goals for the QAPI meetings. Michelle, I think it's back a few slides. This one. Okay, so CMS goals for patient family engagement and QAPI. So CMS, or the Centers for Medicare and Medicaid, they focus on patient participation and quality assurance and performance improvement, so QAPI, as a component of the patient engagement. Ways to include patients, if you could just designate the first 5 to 10 minutes at the start of the meeting for the patient representatives to be present and discuss their concerns. Keep the meeting to overall quality of care discussions and not provide individual patient care when the patient is in the meeting. Offer options to present in person. They could write a report or they could even call in. They could follow up with, and then they can follow up with patients on issues raised. So if they bring an issue to the meeting, once it's addressed, you can follow up with them, they can follow up with the patients as well, and encourage that open dialogue aimed towards solutions. Okay. So we did this slide already. Now we'll go to what's next. So working with your patient facility representative. Your facility may be one of the ones that's chosen to have a one-on-one collaborative partnership with your patient facility representative and the network during the PDSA cycle. If that is the case, the PFR will meet with the network to discuss their role and responsibility during the patient-focused area of the community coalition work. The network will discuss QAPI participation and outcomes with the patient facility representative, and the network will also discuss collaborative work done with the facility and the PFR. Next slide, please. So we're going to also review some of our platforms. So this is our IPRO Learn platform. It's a 24/7 learning management system. Once you log in, you have like announcements, if there's symposiums, educational opportunities coming up in your area, any policy changes, any facility shout outs to facilities that are doing great work. When you log in, each facility has a unique username and password. You should have gotten it on your inclusion letter to this community coalition. If you do not have your facility's username and password, please feel free to reach out to us and we can help get that information to you. Once you're logged in, you'll see the announcements. You'll see a to-do section, which is required monthly activities. And each one is considered. Each one is pertaining to home or vaccinations. We have tried to decrease the amount of activities just to lessen the burden to facilities, but all of our activities are used to increase awareness, promote education, and see how the network can help. There's also CEU offerings. If you do the CEU, you need to create your own personal username and password for that, and there are instructions to do that on the website as well. And there's also discussion boards in there too that one time we had one where it was like, share your success with this. And it's great to hear what facilities are doing. Other facilities are able to learn off of those as well. So I recommend you check out the discussion boards. The next slide. So once you log in, this is what it's going to look like. You're going to see the home, the dashboard, my courses, and the center of the page here, this is the announcements. Over here to the right, you're going to see our this is our forums and the toolkits. This is where you'll see the discussion board. And if you click on the toolkit, you can open that, and there's a lot of great resources in there. We just recently this month updated the one for home. So you'll see a lot of great resources from CKD all the way to transitioning patients to home. Next slide, please. So the coalition work is also here in IPRO Learn. You'll see it's going to come up under your facility, and you just click the activity and it'll take you in there on what to do. I want to go to the next slide, please. So this is our Fresh Desk portal, and we can also share these links in the chat so you have them. This is if you have questions. We encourage you to submit tickets for any issues with data, emergency, patient experience of care. So if you have any issues and you want to get to us, please access our Fresh Desk. You can also email Michelle and I as well, but if it's a data question or emergency, I would always recommend going through this portal. The next slide here has the IPRO ESRD Network Program website. This is a central hub to get any of our offerings. There's resources for all areas of our work that Michelle, she reviewed those areas at the beginning of the call. There's more in-depth information about our line of work, publications, partnerships, collaborations, and more. Next slide, please. So this is our Caspio. This is our facility contact database. So whenever you get emails from the network, frequently we'll get, oh, I switched roles. If you do have roles changing in your facility, you can go to this website here and click on, well, we can also share this link. You can go in and update your facility contact information. So if you get a different facility administrator in your facility, you can change that in there, a different social worker. But it's really important that this stays up to date to ensure that we're getting communication to the correct people. And that's all we have. Does anyone have any questions for us? You should be able to unmute your line. If you aren't able to, please let us know and we can unmute you. You can also use the chat as well.
I don't see any questions or anything in the chat, so that is all we have. Thank you for joining our call. Everybody is free to go if there's no questions or comments or anything. Thank you for joining.
Thank you.
Great. Thank you.